Hi, we all have heard about anxiety attacks or panic disorder. And in the modern world, it is estimated that around 1 in 10 people experience at least one panic attack in a year. Isn't that alarming? They may not be frequent, but panic attacks can be triggered by a situation or an object that provokes deep fears. So we all need to recognize our panic attacks and the triggers that bring panic attacks to us. For instance, people who are fearful of social situations, who are fearful of the crowd, may have a panic attack at a party. And it is very scary to think about that. People who are fearful of enclosed spaces might have a panic attack in a lift. Those who primarily have a panic disorder can experience panic attacks apparently in response to a little more than having being afraid of being afraid. So a panic attack is more than being afraid of being afraid. It is often the fear of having a panic attack that starts the attack itself. There is a kind of swirl of thoughts at the heart of panic. Those who suffer panic attacks, they experience various kinds of symptoms, and you should be able to recognize the symptoms. There can be intense fear, a very strong physical reaction to something, and the sensation of being about to die. People are scared to die at that moment, or losing complete mental control. People may witness shortness of breath. They may feel that they are being suffocated. They may have chest pain, upset stomach. So all these are the symptoms of having a panic attack. They can even start sweating and shaking vigorously. That is why many people think that they are having a heart attack sometimes, but that actually is a panic attack. Of course, thinking you are having a heart attack again contributes to the panic, and this kind of vicious circle can set in. This is all in the face of very little real danger, though the real danger may be very less, but a person may think that the person is even going to die. Although it is very different to the person experiencing. The person who is experiencing it may feel intense fear. It's not known exactly why some people have panic attacks and others do not. Following factors are important. Large amount of stress, it can lead to panic attack. Genetic susceptibility. People can be genetically susceptible to having panic attacks. An anxious personality or being particularly prone to negative emotions. And there can be even changes in the brain function. Panic attack brings a lot of complication for the person. Anxiety attacks could be treated because when they are severe, they can interfere with the quality of life. So they have to be recognized first, they should be treated, the person should visit a doctor and start the treatment at once. Panic attack symptoms can leave people in a constant state of fear, and their productivity, their functioning, everything can be hampered because of that. The complication can be having medical care for health concerns, developing specific phobias such as phobia of closed spaces, phobia for heights, fear of driving. It can lead to alcohol and other substance misuse. Problems with finances, avoiding social situations, anxiety, depression, and other psychological disorders can set in because of the panic attacks. And there can be even higher risk of suicidal thoughts. So panic attacks need to be treated well in time, and the treatment may involve certain medications. You can have mindfulness activities, relaxation techniques, or even yoga can help you a lot. And even lifestyle changes are very important in the treatment process. And one of the most important things is accepting the experience, reminding yourself that the experience will be over soon and you have even survived it before. So while having a panic attack, accept that you are having a panic attack and you have come out of it many times, and this time you will be successful in doing that.